So we know that vitamin D is important. These days, the role of vitamin D in everything from bone health to the immune system is becoming more, and brain health actually is becoming more and more apparent. So what the liver does is it takes what we absorb from ultraviolet light and is activated in our skin, cholecalciferol, and turns it into 25-hydroxycholecalciferol, otherwise known as 25-hydroxy vitamin D. This is a very important activating role that the liver performs. The 25-hydroxycholecalciferol is then sent to the kidneys to become 125-hydroxycholecalciferol and fully activated vitamin D. So the liver can store about 4 months worth of vitamin D, except in patients who have chronic liver disease. That storage capacity is interrupted. And very often in liver disease, vitamin D levels are extremely low, and patients need significant amounts of vitamin D in order to normalize their vitamin D levels. And we'll talk about that in terms of appropriate supplementation of vitamin D in patients with chronic liver disease. The liver also stores vitamin K for short periods of time, again, except in liver disease where the storage is interrupted. Now, most of our vitamin K comes from intestinal production of vitamin K. That's interrupted when antibiotics are used, and very often in patients who are taking antibiotics for hepatic encephalopathy, their vitamin K levels will even be further reduced. And we'll talk about appropriate supplementation of vitamin K as well. Vitamin E is stored in very small amounts. Most of the vitamin E in the bloodstream comes directly from diet. The liver really cannot store significant amounts of vitamin E. And finally, vitamin A. The problem with vitamin A and liver disease, of course, is the liver loses its capacity to safely store vitamin A, and vitamin A toxicity is really the danger with liver disease. Now, carotenoids, which are pigments that are found in red and yellow vegetables and fruits, those are safe because the small intestine actually turns carotenes into vitamin A. That happens inside the epithelium of the small intestine, and there is a mechanism there that prevents excessive production of vitamin A. So you don't have to worry about that same danger if you give patients a diet high in carotenoids. That's perfectly safe. Even carrot juice cannot cause vitamin A toxicity. It can cause carotenemia, which is storage of those carotenoids in the skin, which can turn the palms of the hands and the soles of the feet orange, but that's not going to damage the liver. So the other very, very important task of the liver is hormone production. The liver produces many hormones. I've just listed a few of them here just to give you an idea about what these hormones do. Angiotensinogen actually is a precursor to angiotensin and regulates blood pressure. Hepcidin, we're learning more and more about that as we understand the role of vitamin D in the immune system. Vitamin D actually activates hepcidin, and hepcidin is a very important hormone in terms of white blood cell function. Beta-trophin is a hormone that actually functions in the pancreas, actually goes to the pancreas and regulates pancreatic beta cell function, so very important in insulin production and insulin sensitivity. Thrombopoietin is a hormone that allows for proper platelet function and blood clotting. And insulin-like growth factor, IGF-1, we hear a lot about IGF-1 because that's how growth hormone works. Growth hormone works by producing IGF-1 in the liver, and then the IGF-1 goes to the bone to ensure healthy bone storage and to make sure that net bone breakdown doesn't happen. So bone is always, bone is very metabolically active. Bone is always being produced and breaking down. There's definitely always a balance between the anabolic bone trophic